It's been a very busy month, busy May for Sorrento. You sold off rights to Synvolic, I hope I'm pronouncing that correctly, to Natpharm for $1.3 billion. This is a bioequivalent to Abraxane, a very promising new drug to treat a number of cancers. Why'd you sell it?
Oh, it's into good hands, in the experienced hands that developed the albumin-bound paclitaxel, which is a blockbuster drugs. And then we have the collaboration, fortunately, with the experienced team that knows how to move the drug forward, especially establish the efficacy that can be beneficial for the patient and the payers.
Henry G., I'm wondering if you could describe for us what kind of work you're doing in the area of breast cancer.
So the breast cancer, we have the chemotherapy that can be useful and for treating the breast cancer patient. We also have the immunotherapy, that including the immunocheckpoints, the PD-1, PD-L1 antibodies, also immunocellular therapy that we are focusing on effort right now, primarily as the CAR-T and the CAR-Tank space, which with our collaborators, Conquest, we have off-the-shelf NK92 cells that's very powerful in killing the tumor cells.
Dr. G, I just want to
receptor into it.
Dr. G, I just want to break in because people may not be familiar with all of these terms. I'm just wondering if you can describe this idea of an antibody library or antibody platform, and just take maybe a 30,000-foot view so that we can understand it.
Yes, so we're basically taking the human lymphocytes and isolate the genes out of the lymphocyte and using the molecular biology, gene cloning, to putting all these antibody genes, fully human antibody genes, into a library that become the rich source for discovery therapeutic antibodies from the library. So we have called that GMAP. In a simple term, the GMAP is such as the Google Maps, that you have a very large collection. We have the largest collection of a human therapeutic library, antibody in the library, and they have the best search engine as well. We have the best screening and technology for the GMAP technology.
Dr. G, given the incredible run your stock price has had, a lot of brows have risen. A lot of people are suggesting you may be a takeover target. I don't know what's wrong this morning. Have you had any talks with potential buyers? Are you interested in selling?
There is always discussions that our company is very undervalued at this moment because we have many assets, both in the clinical stage and in the preclinical stage. We have the most promise in the platform immunocheckpoints, inhibitors in the antibody space, as well as the immunocellular space, which is such as the CAR-T and the CAR-NK cells, which is an emerging powerful play in the CAR-Tank. We call tumor-attacking nucleoplast. With our Conquest partners, we are very big into the CAR-Tank space because the CAR-Tank is a very powerful platform for immunotherapy for cancer and some other infectious disease.
All right, Dr. Henry G., thank you very much. Oh, pardon?
So we believe that our goal is to make sure that we increase the value for the shareholders before anybody is coming over and take this over.